Hey guys, this is Curtis Alexander. I'm a pharmacist. In this video, I'm going to be going over the prescription medication Atenolol. This is part of the 101 series where I just give you an overview of the medication, dosing, uses, side effects, warnings. I'll tackle some of the questions I get specifically about it. Excuse me, and then I'm just going to give you my overall view. So hopping right into it, right away when I want to say Atenolol is class of medications called the beta blocker. Okay, now one of the things most important to remember about the drug, you cannot stop it quickly. Okay, so you get this question a lot, like, I don't want to be on this medication anymore. People don't talk to their doctor, they don't talk to their pharmacist, they stop it, they get into trouble. Atenolol is one of those medications that can get you in a lot of trouble. Coronary artery disease, and that's what we're worried about. It's actually unrecognized in a lot of people. More people have it than they think, and when they stop it abruptly, run into problems. So do not stop abruptly. So what's it used for? It actually has a lot of uses. It's an old medication, but primarily we see it for people who are treating high blood pressure. As far as dosing, it's another one that we want to start low, move up slow. Usually we'll start at 25 milligrams a day, maybe 25 milligrams twice a day, and then slowly move up or titrate up over usually weeks to months. You usually don't move it up any faster than at 1 week intervals because it comes with some side effects. We'll talk about those in a second. And so we want to go slow. Same thing happens if you and your doctor agree to stop it. Got to go slow, okay? Generally speaking, we don't see it much over 100 milligrams a day. You can take that in a single dose or in 2 doses each day. Now, what does it do in your body? This part's pretty interesting. So when you talk about beta blockers, you have beta blockers that are selective, and then you have ones that are non-selective. The good thing about Atenolol is it's selective, meaning it's only hitting one beta receptor, and that's beta 1. It can hit beta 2, but you gotta use pretty high doses to see that. So for most people, it's just gonna hit beta 1. Now our beta 1 receptors are primarily in our heart, our kidney, and our fat cells, okay? We'll get to the fat cells because that's a common question. All right, so it's a selective beta 1 receptor. So it works a lot on the heart and the kidneys. Now, how about warnings? So first of all, one of the things we have to be careful about is people with diabetes, because Atenolol can actually make hypoglycemia or low blood sugars worse, and it can also mask the symptoms of hypoglycemia. Again, because when somebody goes hypoglycemic, they'll start to get, heart rate changes, so on and so forth. Because we're affecting those beta receptors in the heart, they don't recognize that they're getting low blood sugars. So something to keep an eye out for if you're diabetic. Obviously, because it works in the heart, it slows heart rate, it does these things. We have to be careful with people who have heart failure. It can make that worse, okay? And then myasthenia gravis, we want to use with caution in that myasthenia is kind of a complicated condition, neurological condition. I don't want to get too much into it. But if you do have that, obviously something to be careful with. Now, side effects. Right off the bat, let's get the 2 big ones. Because it works on the heart, hypotension or low blood pressure, we see in upwards 1 in 4 people get that. If you start slow at a low dose, we can really minimize that, but it can be a problem. We also see bradycardia. At 18%, bradycardia is the slow heart rate. So again, it's all heart effects, so that's something we want to watch out for. We can also see atrial fibrillation at 5%, not common, but anybody, you want to be monitored closely if you're on Atenolol with any sort of heart condition. And then, of course, dizziness. This is going to be related to the low blood pressure, 1 to 4% of people. And then nausea at 4%. Now, big question is, can Atenolol cause weight gain? In my opinion, the evidence I've seen, yes, it can. You can usually attribute anywhere from 1 to 4 to 5 pounds to the atenolol. Again, because you have beta receptors in your fat cells, that's what we think is going on, is that by blocking those, you're getting less fat breakdown. But again, the weight gain is not substantial by most people's standards. Just be aware that it's something that could happen. So if you've, I guess my overall viewpoint, atenolol, it's cheap, usually well tolerated if you go slow, and it can be used for a number of different things. So those are some of the good points. The bad points are it can come with side effects because it's an old drug, and some people just doesn't agree with them. All right, so if you've taken atenolol, drop something in the comments. I'd love to hear your experience. If you know anybody else who did, it's helpful for me. It's helpful for other people who are watching the video. So I appreciate you doing that. I hope the video was helpful. I hope it was valuable. Please let me know other videos that you'd like to see as well in the comments. And until the next one, thank you.